So our Multidisciplinary Asthma Clinic is really a great place for patients who have asthma, who also have allergies, who possibly have had really bad illnesses related to asthma in the past. In that clinic, these patients are able to meet with a team including allergy, pulmonary. They're able to meet with a dietitian to talk about nutritional effects of asthma and optimal nutrition for children with asthma. They're able to meet with a social worker if there are environmental concerns in the home or other concerns that a social worker could be able to help out with. The multidisciplinary team takes an approach to nearly every facet of this child's illness and helps center the treatment on that specific child's needs. That makes my job easier because I know if I have a patient who's really struggling in clinic, who's having a hard time maybe seeing us and the allergy clinic, or who has a lot of questions for us and a lot of needs at home, it's great that I have that resource to be able to send them to and to have it be so accessible. You can come to Children's for just a few hours and be able to have all of your questions answered when it comes to your child's asthma and allergies. You have the time and the space to discuss your questions with experts. You can have all your questions answered and then go home with a lot of information on how you can help manage your child's asthma at home. So it's an incredible resource and it's really efficient just to be able to come to the hospital and have really almost all of your child's needs met within that one visit. We have the Parent Smart Hotline, which is available 24/7, and we also have a pulmonary triage line for our established pulmonary patients when their parents have questions. The really cool thing about that is that during business hours, they're able to call us and essentially get right to a nurse and ask their question. So for example, if a parent has a daughter who has asthma and she's been coughing for a couple of days, but the parent's not really sure if she needs to see her doctor or not, she can call our hotline here in the pulmonary clinic and be able to reach a nurse just like that. We staff 2 registered nurses Monday through Friday, 8 to 5, directly on those phones. So we are the ones who actually pick up the phone. One of the highlights of my job is being able to play alongside a kid when they're waiting in clinic, or to see a patient do better after we've been able to treat them, and then to have the child remember us when they come back, and they remember us in a good way. They are not afraid of us anymore. They say hi, they tell us about their kindergarten teacher. It's really fun. Our first priority is the children. We want to make sure that we provide family-centered care. We want to make sure that their questions are answered, and I think that's really unique.